Um, uh, Good afternoon, everyone, and welcome to the inaugural meeting of South East London CCG. Just before we begin, I'm going to hand over to Christina Windell, our Chief Operating Officer, just to talk a little bit about how this meeting is going to work, because it is a relative novelty to all of us. So, Christina, could you just say a word or two about how this meeting is going to work?
Yeah, absolutely. Thanks, John T. So just want to say a huge welcome and thank you to anyone who might be watching as we are live streaming this meeting through the website. Hopefully you will be able to see some of us as we speak through the papers and also the papers themselves. There's also the ability, and we're really keen for you to interact with us, so please do let us know that you are watching, and there is a Q&A functionality which you will hopefully see on your screen. Just to let you know, when you ask a question, you won't immediately see it published and we won't immediately respond to it, but we have a Q&A session at the beginning and at the end of the meeting, and we will publish, so make visible to all, some of the questions in that time. Obviously, we're not sure how many questions that we'll get, so we'll only have time for sort of 3 or 4 in each of those sessions, but we will make sure that we get back to everyone with answers to their questions following the meeting. As well as streaming this meeting, we are also recording it, so there is the ability to watch afterwards. And also, if there's anything that you miss, for example, when we're showing a paper and you want to look at it again, you do have the ability before we finish the meeting for you to kind of record and look back at any bits of it. So if we go too fast, there is the ability to review any of that should you need to. So yeah, we look forward to hearing you in the Q&A session and hope that you find the meeting of use.
Thanks, Christina, that's great. And also a really warm welcome from me. So my name's John T. I'm the chair of South East London CCG, and this is our inaugural meeting. I guess just in terms of setting the scene a little bit, I'm not sure that any of us would have anticipated, well, a year and a half ago when we began the process of bringing together the 6 CCGs across South East London, that our first meeting would be in this form. So I first of all wanted to acknowledge that this is unusual. We have tried to use technology in a way that will enable us to be as transparent and engage as effectively with local residents as possible. But it is a bit of a learning curve. I'm hoping that things will run smoothly, but I absolutely anticipate that we will, as we continue to use this technology and we continue to have meetings in this way, we will get better at doing it. So you are also very, very welcome to share thoughts during or after the meeting about how we can improve the way in which we run these meetings in public going forward. I guess just by way of introduction, I did also want to speak very briefly about some of the challenges the system are facing, and we're going to focus quite a lot in the meeting on that. I've already said that I don't think we could have anticipated our first meeting in public would have been in this form, nor could we have anticipated the level of the public health emergency that we have been managing in the first few weeks of Southwark CCG being established. I wanted particularly, therefore, to kind of call out and thank the health and care services across South East London who have been responding to the pandemic. It's been an incredible few weeks. We've seen huge commitment from frontline staff, from carers, paid and unpaid, in supporting some of our most vulnerable members of the population. We've seen incredible working in partnership across South East London between providers and commissioners, and with our local authorities. From my point of view, it's been an incredible sort of experience to really see what can happen when health and care systems come together, and I hope it's something that we now continue to build on as we move towards a more integrated care system across South East London. I wanted particularly to thank CCG staff who through this process have had to adapt and adopt new roles. We'll hear a little bit from some of them later in the meeting, but many have been redeployed. And there's an enormous amount of work that's been going on behind the scenes to help support and coordinate an awful lot of the activity that's been taking place across South East London. So I wanted personally, on behalf of the governing body, not just to thank all of the incredible frontline staff and teams who've been providing care to residents in South East London, but also thank the teams and the staff in the CCG who have been doing so much to help coordinate our response in South East London. We are now moving into a slightly different phase of the pandemic, so at this particular moment in time, as we have this meeting, we are shifting to look at how we're going to respond to that next phase. So there's an enormous amount of planning taking place, some of which is very emergent, and we will touch on. But most of all, I wanted to ensure that during this meeting, we're able to bring everybody up to speed with the work that has been going on and the particular challenges and opportunities that we currently have across South East London. We are operating in a very different environment, and that will be clear to everyone. But I think it's important that we absolutely continue to fulfil our functions as a clinically led commissioning organisation for South East London. And that's why we will also ensure on the agenda that we touch on some of those specific roles that we have, particularly around quality and safety and thinking about our population and their needs first and foremost. So I hope that's helpful by way of introduction from me, just in terms of setting the scene, both in terms of some of the technical challenges that we might face, but also the particular context we find ourselves in at the moment. On that note, I would very much like members of the governing body to introduce themselves. And I wonder whether I could help orchestrate this by just running through the attendees that I have on my screen here. So in no particular order, Di, I wonder whether you could just let people see who you are.
I'm Di Aitken. I'm a GP from Lambeth, and I'm also Assistant Clinical Chair.
Thanks, Di. And Clive next, please.
Hello, I'm Dr. Clive Angiansa, GP in Bexley, and I'm Clinical Lead Representative for South East London for Bexley.
Great. Simon, did you want to introduce yourself? I know you're busy behind the scenes. Possibly.
Is that Simon Beard or Simon McKenzie?
Simon Beard, sorry. I should be using surnames as well, shouldn't I? Yes, of course. Simon Beard, sorry.
Yeah, hi, I'm afraid I can't put my picture up, but Simon Beard, Associate Director of Corporate Ops for the CCG, and producing this this meeting today for anybody that's watching the live stream.
Thanks, Simon. Angela Barn.
Hello, I'm Angela Barn. I'm Borough-based Director for Bromley. I'm part of the COVID Gold Cell.
Thanks, Angela. Andrew Bland.
Hi there, it's Andrew Bland here. I'm the Accountable Officer of the CCG. I'm also the Integrated Care System Lead for South East London.
Thanks, Andrew. And Sarah Cottingham.
Hello, I'm Sarah Cottingham. I'm the Executive Director of Planning and Commissioning for the CCG.
Thank you, Sarah. And Mary Curie.
Good afternoon, I'm Mary Curry, the registered nurse on the governing body for South East London CCG.
Thanks. Robert Davidson.
Hello, I'm Rob Davidson. I'm a GP based in North Southwark, and clearly I sit on the governing body of South East London CCG. I have particular responsibility for 111 and integrated urgent care.
Thanks, Rob. Sid.
Hi, I'm Sid Deshmukh. I'm GP in SIDCUP, and I'm also clinical lead on the governing body for Bexley.
Great, thank you. And Joy Ellery.
Hi, I'm Joy Ellery. I'm lay member and I lead on patient and public involvement.
Thank you. And Andrew Ayres.
Good afternoon. I'm the Strategic Director for the CCG in Lambeth and also for Lambeth Council for Health and Care.
Thanks, Andrew. Falake, did you want to introduce yourself now?
Yes, hi, I'm Falake Shegun. I'm the South East London Director for Health Ward. representing the 6 health watch organisations in South East London, and through them the population and patients in the public.
Thank you, Falake. Sam Hepplewhite.
Good afternoon, I'm Sam Hepplewhite and I'm Borough Director for Southwark.
Thank you. Neil.
Hello, yes, I'm Neil Kennett-Brown. I'm the Borough Director for Greenwich, and I'm also the Borough Director at the moment for Bexley, but I will shortly be handing over to Stuart Rowbottom, who will be starting as a shared place-based director from the 1st of July.
Thanks, Neil. Nancy.
Hi, I'm Nancy Cushamon, one of the GP leads from Southwark, and I lead on mental health, learning disability and autism.
Thank you, Nancy. And now the other Simon, Mackenzie.
Simon Mackenzie, I'm the secondary care doctor on the CCG. My background is I was an intensive care consultant for many years. I've been medical director in Edinburgh and St George's in southwest London, and I'm an IHI fellow.
Thank you, Simon. Farouk. You may be on mute, Farouk.
Apologies. I'm Farouk Majid, GP from Lewisham, and I've been given the role of Clinical Equalities Lead.
Thanks, Farouk. Adrian.
Hello, I'm Adrian McLaughlin. I'm a Lambeth GP and Clinical Lead on the South East Governing Body.
Thanks, Adrian. Jackie.
Yes, I'm Jackie McLeod and Lewisham GP Lead on the Governing Body. Planned care is the main area of my portfolio.
Thanks, Jackie. Kate.
Hi, good afternoon. I'm Kate Mariotti Baker. I'm the Chief Nurse for South East London CCG, and currently in the COVID period, I'm the Deputy Gold Commander.
Thank you, Kate. Usman.
I'm Usman Niazi. I'm the Chief Financial Officer for the CCG.
Thank you. And Teresa. You may be on mute, Teresa.
Apologies. Good afternoon. My name's Teresa Osborne. I'm the Director of System Commissioning Reform for the CCG.
Thank you. Ruchira.
Hello, I'm Dr. Ruchira Paranjpe, Governing Body Lead for Bromley.
Thanks. And Andrew Parson.
Hello, I'm Dr. Andrew Parson. I'm a GP lead on the governing body from Bromley, and I also co-chair Clinical Programme Board for Our Healthier South East London.
Thanks, Andrew. Jackie Peake.
Hello, I'm Jackie Peake. I'm Executive Manager for South East London and Secretary for this meeting.
And Peter.
Afternoon, I'm Peter Ramraker. I'm a lay member for primary care and commissioning.
Thank you, Peter. Peter, you may want to, if you do want to come in during the meeting, just speak up slightly. Your microphone's slightly quieter than others, but just to let you know. Saba.
Hi, I'm Saba Salman. I'm a GP in Greenwich and Clinical Lead for Workforce and Education on the CCG.
Great, thank you. Sheila.
Hello, I'm Sheila Kirkland. I'm lay member on the CCG and I'm responsible for audit and governance.
Thanks, Sheila. Krishna?
Hi, I'm Dr. Krishna Subrayan, GP from Greenwich, with clinical responsibility for quality, safety and patient experience for the South East London CCG.
Thank you, Krishna. Julian, did you want to say who you are, given that you are also on the call?
Yes, I can do. Thank you, John T. My name is Julian Walker. I'm Communications Manager at the CCG and helping to work on the Q&A function today.
Thank you. Martin Wilkinson.
Hi, afternoon everyone. Martin Wilkinson, Borough Bliss Director in Lewisham and a joint appointment with Lewisham Council and the South East London CCG.
Thanks, Martin. And Christina Windell has already introduced herself. Thank you, Christina. And I've worked out that that was actually in alphabetical order. So fantastic. I think everyone has been introduced. Is there anyone who has not had the opportunity to introduce themselves? Great. OK. So in that case, we don't have any minutes to review because this is our inaugural meeting. We do just need to declare any conflicts of interest. There is a published register of interests. Could I just ask you to indicate if you have had any change in those interests that you need to make us aware of as a governing body, which would need to be minuted, please?
Hello, John T. It's Clive from Bexley. Sorry for the mention. I'd just like to add that I'm a director of Clock Tower Healthcare, which runs the Bursted Wood GP practice in Bexley.
Excellent, thank you. So I know that Jackie, we can make sure that we can capture that into the declaration of interest. It may already have been done, but very helpful for you to flag that. Thank you, Clive. I'm going to assume that no one else has any change in their declared interests, and we will therefore move on to public questions. There's an opportunity both at the beginning and at the end of the meeting to take questions from members of the public, and Christina introduced the way in which we're going to be doing that. I guess what I did want to just flag, and Christina mentioned this, is that we have had a number of questions from the public that have come in already, and it's incredibly helpful that people send questions in advance. What we've been able to do, therefore, is to respond to those in writing. Some of them required more detailed responses. Where that's the case, we have committed to ensure that we provide that response in writing and publish that following the meeting. Just so that people are aware, this has covered a range of issues and really, I think a very rich set of questions that we've had, covering concerns over care homes, the impact that the pandemic has had on the way in which services have been delivered and any backlog that there might be on elective procedures, cancellations to people's operations. Also the impact of the pandemic on the population, particularly flagging some groups within our population who have been more affected, particularly the Black, Asian and minority ethnic groups, but also LGBTQIA+ groups. We've had questions covering a number of specific population groups that we will also ensure that we address. We've had a number of questions, unsurprisingly in many ways, about the impact the pandemic has had on mental health and well-being, some specific questions on children's services, questions on the CCG itself, how we are involved in planning for the next phase of the pandemic, how we're engaging the public in any changes that are being proposed, some specific questions about the involvement of the private sector in helping to support the response to the pandemic, and some questions about the way in which we have been managing infection control, for example, in urgent care and treatment centres. So you'll see a very, very wide range of questions, and our intention is not to read through the answers to all of those questions, but what you can see on the screen in front of you is that we have provided written responses, and where we think there's more detail needed, we will be forming those written responses rapidly after the meeting, so that they can be published with the minutes of the meeting. So I just wanted to flag that. I also wanted to say that if we have a number of questions from the public, we won't necessarily have time to get to all of them, but we will answer all of them. So we will do what we can to answer the questions during the live streaming currently, but any that we can't get to, because we probably only have time for 4 or 5 questions at the beginning and at the end, we will nevertheless capture every question that's been answered, and we will answer every question. And again, that will be published with the minutes of the meeting. So I hope that's useful, just to flag how we have approached this. And again, we welcome any feedback on the way in which we are managing the meeting. So on that note, I am just going to check in with Christina as to whether there are currently any questions that have come in for this first part of the meeting. Otherwise, we will of course come to more questions when we have a public open space at the end of the meeting as well.
Thanks so much, Jonty. So yes, very pleased to say that we have got a question from Fraser Sim from Lambeth. He has asked about the prospectus document that was discussed prior to March. He has asked whether the introduction to the CCG document that's been made available is that a marketing leaflet, or is that the prospectus? Is the expectation that it's a living document, and if so, how often is it likely to be updated? If it's not, will there be a living document? And he's also made reference to the fact that we have called out that some of the CCGs previously had received national recognition for the quality of their engagement, and he was asking which CCGs those were. So I wondered maybe if Andrew might like to answer that question.
Absolutely, and I think more specifically on the engagement, I might then just come to you, Joy, if you wanted to say a word after Andrew's finished.
Thank you, Chair, and Fraser, thank you very much for the question and for using our technology. So I hope I can use it as well. Quite right, we've made a commitment to a prospectus. I equally think I recall, and I'm certain that you're correct, we've set a target date for the 1st of April for a publication of the prospectus. In the event, we did publish that later in April. Partly around some final appointments to the CCG, and we did not want to leave some boroughs unaccounted for in personnel terms. So, but equally in the same period of publication being due, so as close to the beginning of the CCG as possible, we did enter a lockdown period nationally for COVID, but equally suspended some of our business as usual activities. So I can clearly apologise for that slight delay. However, I equally make less apology for us diverting some of our resources to the pandemic response. I did, and we have described it as a prospectus in Lambeth. That hasn't been consistently described as a prospectus elsewhere. In the end, we entitled it an introduction. I think that is an accurate description of what it is, and it is a nod to our intention to update that type of information and make it available. What we are undecided upon, and we can be clear on this, is whether we update that specific document or use our website where it is readily found, or will readily found, to provide that type of information as we move through our life as a new organisation and CCG. So I do anticipate updates. Whether it will be in that specific form or not, undecided, and happy to be clear on that in the near future if that is an important point. And then finally, I mean, I should just say, I think I'm right to say that all 6 of our boroughs receive some of the highest ratings for engagement in the country across the piece, actually. So it's unfortunate, but equally I'm delighted to say that from my understanding, it was Bromley and Southwark that are the boroughs that I was referencing. They certainly were amongst the highest performers in the country, and were certainly asked to share their way of working with others in and outside of London to help them improve. And given the importance we place on engagement, we're very proud of that and wish to maintain it in this new CCG.
Thanks, Andrew. And obviously that's been one of the great benefits, certainly that I've noticed over the last few weeks of working together, is that each of the boroughs bring a tremendous amount of expertise, and we're still very much functioning as an organisation that recognises the value of that borough-based working. Joy, I didn't know whether you wanted just to say anything specific about the learning that there's been about the excellent engagement work that's gone on in individual boroughs.
Yes, I would. Thank you very much, Jonty, and thank you for the question, Fraser. I'm sure you're aware in January, February, March, we were started to discuss our approach to engagement in the 6 boroughs, because as Andrew has said, and as you've highlighted, there's some excellent work that's been going on in all the boroughs, and I could highlight engagement work that's gone in every borough. And I think our approach to engagement needs to pick up on the best of each borough. You'll appreciate that since, I suppose, April and May, engagement has been diverted towards communications and informing the public, but that doesn't mean to say that engagement has dropped off at all. And certainly we will be starting again talking about our approach to engagement with all the people that we know are interested in this throughout all 6 boroughs. And I'd be delighted to have conversations with you going forward.
Thanks, Joy. So we do have a further question, and essentially, Christine, if you're happy, I will just read the question out. Although, actually, why don't you? Because I can't see who it's from, and you may know that. So why don't you just let us know the next question that's come up?
Yeah, no problem at all. And actually, one more question has come up as well. So Tony O'Sullivan has asked, please could the CCG explain its response to the requirement from David Sloman that each ICS delivers a revised ICS plan by Monday, the 11th of May?
Okay, so in the interests of time, Tony, that is a question that has already been answered in advance, so we can point you towards that. I guess, however, Andrew, and I think it might just be helpful just in a couple of sentences just to describe the particular way in which this planning process has been gone about, because I think there might be a little bit of misunderstanding about the extent to which this is essentially a response to a regional request or an ICS plan. Would it just be worth saying a word or two on that?
I just think to avoid confusion, I don't know if Christina or Simon have the written response available to them. It will take a couple of seconds to read that response. Is that possible? I haven't got it right in front of me. I can paraphrase it if helpful. It's question 9, I believe.
Yeah. Are you able to put that up, Simon?
I can read it as well if that's helpful. So yeah, so the CCG is absolutely making responding to that. Importantly, the journey to the new healthcare system is a regional framework that all London ICS and STP partners have been asked to make an initial response to. Partners across the South East London ICS, including the CCG, are involved in considering that framework and the types of responses that would be required by it. The framework has been issued for the initial response of London partners. It doesn't represent the CCG or ICS's full plan for responding to recovery. We're working with representatives from partners across the ICS, including our local authorities and social care, to develop plans that reflect the needs of our population in South East London. The way in which we approach our plan is still under consideration and will be brought forward to sovereign bodies partners in due course. It's inevitable that changes to services have had to be implemented in response to the current public health emergency. But we will be looking at all of this and considering all of this in our fuller response.
Thanks, Christina. That's very helpful. And obviously all of this will be published. I think you said there was one further question, and then we probably should move into the business of the meeting, and we can come back at the end for further questions.
Yeah, absolutely. Thank you. So it was just a question to say and ask whether the questions and answers that were displayed from answers submitted previously could be shared on the website rather than waiting for the minutes. So just to say 2 things, all of the questions that we received in advance of the meeting have already been published on the website in terms of our initial responses. All of the questions that we're receiving now, and some we are kind of publishing, but all of the questions that will be submitted will be answered. And in fact, we've agreed to accelerate the timeline and they will be available within a week.
Thank you very much indeed. And thank you very much for those questions. It's great to be kind of trying to interact in this way. As I say, we're sort of testing out this way of working at the moment. And interestingly, one of the questions that came in advance was the extent to which we might be able to adopt some of this technology and have blended meetings going forward so that we can ensure we can involve as many people from the public as possible. So this is a sort of learning experience for us, and I'm really appreciative for the engagement that we're receiving as part of this. So let's move on then into the business of the meeting. We have done well, I suppose, as a team, really. We've been doing quite a lot of development over really just prior to the pandemic and since then to think about the kind of organisation and the sort of values that we want. And one of the things that came up very clearly was our desire to try to ensure that we showcase an awful lot of what is positive, and that we think very much about our staff and the workforce. So one of the things that we wanted to do at the beginning of the meeting was just to show a little bit of what has been happening, particularly in the primary and community care space over the last few weeks, but also just before doing that, to share some stories from some of the staff from the CCG who have been redeployed. So I wonder whether we could show those two films at this point, please. So I'm assuming we're just having another go at that so that we've got some sound. Is that right?
Yeah, Peter, I've still got that problem with sound. Still got a problem with sound.
Yeah. No, not there, not there. Is it share?
Yeah, I'm sharing.
Right.
Let me stop sharing.
Share, and then this one flashed up there.
Yeah, I think it's because
Simon, do you want us to carry on and come back to this, or are you happy that it's resolvable?
Yeah, I think if you can carry on, and then we'll come back to it.
Okay, that sounds absolutely fine. So we'll ensure that we come back to those two short films. But in the meantime, why don't we move on to the rest of the agenda? And I wonder whether I could then move to item 5, which essentially is an update around the response that there's been to the COVID-19 pandemic. I think we're going to just begin with an update from public health colleagues. So Nada, I'm hoping is available to give us that, and then we have got some papers that have come forward from Sarah and also from Kate. So can we go through it in that order? Nada first.
Thank you, Chair. Thank you very much for inviting me. I'm Nada Lemick. I'm a Director of Public Health in Bromley, and I'm representing all 6 public health departments here. And the presentation is actually a combined effort of colleagues, and I will present the information and data on all 6 departments. So may I have the first slide, please? The next slide, please. Sorry, Simon, may I have a next slide, please?
Yeah, sorry, just bear with us one moment while I'm trying to share this.
Thank you. Well, I can start talking. Well, I will talk a little bit first about some data, which is in public domain, so because people will know about it. It's it was put together on the 13th of May, so it is a little bit out of date, but we had to put a presentation on the 13th together. So the first thing that I will, when we see the slides, it will be about the new cases across. Thank you, Simon. Yes. May I have the next slide, please? Yes. So this first slide is about new cases across London, and you can see the red bars are our boroughs. Can I just, before I talk about data further, just to put a warning, of course, this data, particularly new cases, depend very much on testing, how many people have been tested, because of course we will have more confirmed cases if testing is done more. So this first graph just shows the number of confirmed cases. Next one, please. Oops. This is actually, again, cumulative new cases, but per 100,000 population, which takes into account the size of the borough population. So, but it still shows the same thing, and our boroughs are in red colour. The next one, please. This is looking at, if you look at cumulative cases across London, differences between a male and a female. And you can see that obviously we know that there seem to be more men as confirmed cases, especially in the middle age group. When you look at the older age group, there are more females, but that could be probably is the reflection of greater number of females in the very old age groups. Next slide, please. Next, yeah. This is the number of deaths, again, with our boroughs in red. Just again to say that death and very much depends on, again, on testing, whether they're confirmed, the cases that died their death have been confirmed by testing, but also it's the question of how well the deaths have been coded and whether they have been coded correctly. So again, a little caveat to take all this data, we have to be cautious how we interpret it. Next one, please. And this is just to show the place of death, and you will see that obviously the largest number of people, unfortunately, have died in the hospital, and this is the same for all of our boroughs, followed by care homes and then home and community. Thank you. Next slide, please. This is just to show the cumulative data across England, and again just to show that of course we have the highest proportion of death in the elderly and very old. Thank you. The next one, please. Right, what I would like to talk a little bit more about is about the impact of COVID-19, because of course this is what is something that is concerning us all, and what will it mean in particular on health, what the health impact will be, social impact, and of course economic impact. The structure of this slide is made in such a way to firstly, if you look at the health impact, what are the areas that we should particularly be focused on, and then what we think which particular groups may be particularly impacted. Now, in terms of health impact, of course, chronic conditions are something that we are all concerned what will be impact on people with chronic conditions, because as we know that a number of people attending acute hospitals has dropped, that hospitals and community services are really providing essential care. So there might be that people with chronic conditions there might be an impact on their conditions. Equally, and we in public health are particularly concerned about some preventative services which have been paused. Screening, particularly cancer screening, is of a concern because we don't know what the impact of that would be. Some school immunisations have been paused because schools have been closed, so the public health impact of that could be significant. Now, in terms of social impact, of course, we have all been isolated and being a lot of us working from home, and what the impact of that would be on populations already and longer term, in particular on mental health. And there is a lot that's been already done, and people have been particularly considering mental health issues. Issues of safeguarding, when we have people in overcrowding conditions, spending a lot of time together, and there seems to be some information and some concerns about domestic violence and issues for children. Now, of course, we in public health are always interested in behaviours, and there is some evidence that there has been changes in behaviours. The population, in particular, in terms of diet and alcohol. There is some data suggesting that sales of alcohol have increased, so that is obviously of a concern. The issue of physical activity, of course, if we are indoors, we may be less likely to engage in physical activity. Now, economic impact is, of course, something that we all are concerned about. We know that a lot of businesses have been closed, and there seems to be some indication in terms of income that people on lower income, you already worked in the businesses that are more likely to be closed, so there is a double problem there. And of course, food security. Elderly people who are on a lower income may have issues with access to food. So overall, these are just the few areas that we can start considering and thinking what could we do to mitigate against it. You will know that there has been quite a lot of work done on mental health, and South East London CCG is commissioning some work on mental health to support and develop some digital platforms to help people. But that is something that I think we will all need to consider across, and not only across South East London, but London-wide and nationally. May I have the next slide, please? Sorry, yeah, thank you. Final two slides are just something about public health work. Now, these two slides are a combination of the work that has been done across the 6 boroughs. So it presents what colleagues have given me and what I know that it's been happening. So it's been grouped into 4 areas. The first one I won't talk in detail, but just to say there's of course public health staff provide a lot of corporate support into the local authorities, and there's a list of things that's been going on. But the second one, infection prevention and control, is obviously one of our big areas. And this is a public health emergency, a big pandemic. So, of course, public health teams have been involved in managing the pandemic. And I could say that probably 80 to 90% of the work the teams are currently doing, and that's not only obviously South East London, but across London and nationally, is related to infection prevention, control and managing of the outbreaks. So there's a list of things that colleagues are doing. I could just want to highlight, of course, there's been enormous amount of work working with care homes, supporting in terms of IPC guidelines, but also with PPE. And some colleagues have done some work across London. Ruth Hutt from Lambeth has actually worked on developing a London-wide quick reference guides for PPE, and that has been recommended across London and nationally. So we've been involved in wider work as well. Can I have the next slide, please? And the other 2 areas that are obviously important for us is the community support, and colleagues have been doing a lot of work. The one big area is support to the community hubs in terms of volunteer support, development of programs for them, development of guidance for volunteers in terms of IPC, support and developmental work on Black and Asian minority groups, and some colleagues have done particularly a lot of work, and I've got here some specifics in Lambeth. Colleagues in Lambeth have been doing a lot of work with Black Thrive. There has been a special work in Lewisham on Black and Asian minority groups on health inequalities. Colleagues have done a lot of work jointly with their Health and Wellbeing Board and with Birmingham City Council. And actually from Lewisham I have a request to the CCG governing body that they would like to have some input from the CCG into that local work in particular. And the final area for us is, of course, our own services, which we through this pandemic we cannot forget. We have been doing quite a lot of work to make sure that those service areas and services like drugs and alcohol service, sexual health services, 0 to 19 services are still functioning, that we work with providers and ensure that they are being paid normally, and that services are still adapted to this new and unusual situation. I shall stop here and take any questions.
Thanks, Nada. So what I'm going to do, if it's okay, because you can, if you can hang on for a second, we have got governing body members who I know will want to ask questions. But I would like, if possible, to just run through the. Sorry, there's a bit of an echo. Could everyone just go on mute? Simon, thanks. So what we'll do is we'll just go through some of the other presentations around the pandemic, and then I'll come back to governing body members, and I promise, take all of your questions. So I wonder whether we could go next to Christina, and then I think it's Sarah and Kate, and then, as I say, I'll come back and take questions on all aspects of the pandemic response, but really helpful to set the scenes with some of that public health data. Thank you. Christina.
Brilliant. Thanks so much, Jonty and Nada, for that. Really interesting. So yeah, I just wanted to talk a little bit about the current status of the pandemic in South East London in terms of some of the key stats. A little bit about our arrangements in terms of how we have responded to it. And then I'm going to hand it over to Sarah just to talk a little bit about our recovery planning. So in terms of current statistics in South East London, there are approximately 6,065 people who have been or are confirmed cases across our boroughs. The highest number of those is in Bromley, closely followed by Southwark, and our lowest is in Greenwich. We have also sadly had 1,414 deaths of residents and 1,088 deaths of people in trusts. Just to note I'll ask Simon, if you move on from that slide, in fact, so we actually received an updated set of numbers last night. So the version that is on the website is the numbers that I read out, those are the correct numbers. So just to recap, because you weren't shown it on screen, it's 6,065 people across South East London, 1,414 deaths, and 1,088 deaths in acute trust. The reason for those numbers being different is the acute trust number is anyone who has sadly passed away in any of our acute trusts, whilst the 1,414 number is the number of residents that have sadly passed away. So obviously high numbers there. On the positive side, however, the changes that we're seeing week by week are decreasing, which goes as you will have heard from national announcements about the fact that we're sort of flattening the curve, so moving in the positive direction. But of course, we want to get those numbers down absolutely as low as possible. In terms of our arrangement, we are working as a system in terms of our response to COVID. The South East London CCG has supported in a coordination and a leadership manner. We have set up since March, we have had a coordination team up and running, providing 7 days a week support to make sure that we can coordinate our responses, both in terms of being a single point of contact from the various requirements and responses that we get from from our regulators and across the system, and cascading information down effectively to others, as well as coordinating and helping partners come together to devise and respond effectively and quickly. If you wouldn't mind moving to the next slide. We have, as I mentioned, a coordination centre which acts as the point of management across various activities. We also have a Gold Command team, so Angela Barn is our Gold Commander and Kate Moriarty Baker is our Deputy Gold Commander. And in addition, Sarah Cottingham, Andrew Bland, myself, kind of all work as part of a Gold team to make sure that, who meet every single day, to make sure that we're able to understand and respond to any questions, concerns, needs for sign-off, etc. that there might be. We work really closely with a group of system leaders that again meet very regularly throughout the week, which includes reps from across our trust, Jonty representing both the CCG and also importantly kind of primary care and local authority contacts to make sure that we have a really rapid ability to discuss key issues. Those groups interact very frequently with any individual arrangements that there are in provider organisations, as well as the fact that each borough has its own resilience forum, which is a combination of local authority, CCG and other colleagues to make sure that there's a really effective response both at a borough level as well as at a South East London level. If we just move actually to the slide after next, just in light of time, in addition to the ability to react to things that are happening quickly, we're also wanting to make sure that we have appropriate arrangements in place to respond to the longer term things that have needed sort of development, and we've set up a number of work streams and coordination points for that. The slide that you're seeing on screen now is our work streams, main work streams, and also our cross-cutting enabler work streams that support this. In terms of the role of the CCG in the system, the names that you see on there are CCG contacts, and they act as a point of coordination and leadership. But in all cases, we are working with our partners to make sure that it is both a agreed and supported approach across South East London. It has the appropriate views and a range of views as part of that, and also that we can link in to our provider colleagues, our local authority colleagues really effectively. In addition to the substantive work streams, we also have a number of subject matter experts. If you just show the next slide, if you wouldn't mind, where we have other pieces of work with requirements or more ad hoc kind of questions. So in these cases, we have subject matter experts who are we are easily able to kind of point questions, queries or asks to, and they support management of the responses. So a huge amount has been going on since the pandemic started. Just to echo Jonty's point, you know, we should all be really proud of the work that has gone in across the system and the way that we, I think, have been able to work together. Clearly that work will continue, and all of the work that I've described is ongoing, but importantly now we're starting to think about how we plan for recovery and what that looks like, and I'll hand to Sarah Cottingham to talk about that.
Thank you very much, Christina. So the next 3 slides in the papers give you a very high-level overview of the work we've started doing on planning for recovery. The high level is because we have literally started the work, so it's therefore at an early and developing stage, but also respecting the fact we're still in the middle of a major incident situation. We're therefore really trying to take a measured approach to planning and implementation of our recovery actions, and you'll see at the top of this slide we've set out 4 phases, so a really measured approach through different phases that will take us to a full recovery over probably fairly lengthy period of time. The approach we're trying to take is a blend of what it makes sense to do system or South East London wide, what it makes sense to do at a local borough level, and then organisation specific planning. The objective within that really is that we get the right layered approaches, but that they're complementary, that we will work collectively and have a whole system response, and really crucially I think building on some of the really good evidence of collective and collaborative working that we've seen in our pandemic response. The next 2 slides really just try to give a really high level overview of some of the key issues or areas that we are going to seek to address as we start planning for our recovery. So the first one is a continued ability to manage both our current and potential future COVID demand. So we are very mindful of the fact that we need to make sure we've got enough permanent capacity, but also surge capacity to enable us to respond effectively across our whole system in terms of any future COVID demand, in the same way we actually did very successfully during the first escalation. I think Nada referred to the fact that normalised urgent and emergency care demand has reduced during the pandemic, but we are expecting and we equally want to see increased levels of emergency and urgent demand. So part of our planning is to make sure we are able to respond to that, to right size our capacity, but really crucially provide safe and high quality care for all patients, whether they are COVID positive or not. Linked to that, another key element of the planning is around elective or planned care. Again, planned care has reduced significantly during the pandemic, and we are keen to resume in a manner that is safe for patients, diagnostic review and treatment to make sure it's not further delayed, but equally that we can start to reduce the waiting list backlogs that have built up during the pandemic. A common thread across all those 3 areas is infection prevention and control. So a real scrutiny and focus on making sure that all our planning is underpinned by implementing national guidance and evidence-based infection prevention and control to prevent infection transmission. NADA talked about some of the increased health needs arising from the pandemic, and we need as a key area of focus to both assess, understand and plan for this, and that will include particular population groups that we know have been impacted, mental health as an example, and different population groups, to make sure that we are planning effectively to meet those increased needs. And in doing so, we're keen to keep the innovation that we've implemented during the pandemic going. So digital technology is a really good example of a change that has been implemented at pace, while we want a measured approach, and to make sure we retain a range of pathway offers. We are keen to build on some of the momentum we've gained in those areas of intervention. The next slide highlights staff as a key issue, both our staff, but crucially health and care staff across our South East London health and care system. We need to make sure we're providing support to them, be it psychological or safe and supportive environments, but also to understand differential impact of COVID on particular staff groups as well, which will be a key focus going forward. And then equally important, communication and engagement. We've done some very positive communication with public communities, patients during the course of the pandemic, which we want to build on, but really important as well that we're giving clear messages on accessing services, and that patients whose treatment has been delayed have very clear communication about their next steps and what our plans are for them. I guess just important to highlight that planning for recovery will be really important, but we will be doing that in the context of our existing work and our existing priorities. So we already have strategies and plans in place around improving health and health outcomes, reducing inequalities and integrated care. So we will want to make sure that what we're doing on recovery is absolutely linked to and aligned with those existing plans. And a number of speakers referred to the really positive collaborative working and collective work across health and care partners we've seen during the pandemic, and we're really keen that we build on that as we go forward as well. As I said at the beginning, we're still at a very early stage of that recovery, so it will be an evolving picture and a developing area over the next weeks and months. So our plan would be to bring regular updates back to future governing body meetings.
Thank you very much indeed, Sarah. That's a really helpful update. And I think finally, before we open to some questions from the governing body, Kate is going to just talk to us about our approach to quality and safeguarding during the pandemic.
Sorry, I was just on mute then. So thank you, John T. So this paper really sets out the approach that we've taken during COVID with regards really the statutory functions that sit within the Chief Nurse Directorate, and particularly calling out quality assurance and surveillance, safeguarding, but also thinking about some of our complex care that would sit within continuing care and children's continuing care. So if you can just go to the next slide, Simon. So what we have sort of set out in this paper is really the approach that we've taken to quality and safeguarding, but that this is very much focused on and been in response to guidance that we have received from NHS England and NHS Improvement in terms of expected ways of working during this COVID period. We have obviously implemented those, but we have also sought to identify ways of working with our providers and with our boroughs to support local systems, and to identify ways of working that actually supports providers during this time. So this paper sets this out and also gives some early kind of indication around emerging themes and mitigations. Move on to the next slide. So we agreed right at the start some principles with our hospital trusts and general practice, and wrote out to our colleagues both in hospital trusts primary care to set these principles out and agree those. We were very clear that there was an expectation on transparency and candour from all partners, and equally a goal of ensuring that we were maintaining a safe service and we were sharing learning, but that we were not having a penalising approach or punishing for raising quality issues, which is always our approach anyway when we work with our colleagues. So there were some specific things that were agreed. So clinical quality review groups, so CQRGs, were suspended during this time, and they remain suspended at the moment. But in lieu of that, the quality team has worked with trust boards and quality committees to review papers and to work with our hospital trusts on any emerging issues or areas of concern. Serious incidents are required to continue to be reported during this period, but we have taken a pragmatic approach to how we undertake those investigations, and ensuring that immediate safety measures are put in place, but also to ensure that we do identify those urgent lessons. And we also think we've also sort of taken the approach that we need to think about that as we come through our recovery period, because we will want to have the look back to review these lessons. And then the sort of third area, which is of primary importance, is the remaining of duty of candour during this period. So the next slide really sort of sets out how we've approached this. So from a quality assurance point of view, across my directorate, quality teams, and therefore across South East London CCG, we have established a single quality team, and this team has worked across all the boroughs to provide a coordinated, focused response and subject matter expert. We have collated on a weekly basis a summary of serious incidents, quality alerts, and also soft intelligence, and that's been shared with work streams and with myself as the chief nurse. We established a South East London Clinical Advisory Group, which Jonty is the chair of, and to that group we will take quality themes and patient safety themes, and that gives us a point of escalation. The CQC during this period actually nationally suspended inspections, but offered support to providers during this period, and as chief nurse I have worked closely with the CQC heads of inspection to both seek their support and advice, both from the CCG's perspective and also for providers, and to work with them on ways of working that support providers during this time. They have also recently or in the process of launching an emergency support framework, which will focus on adult social care and primary care, and it's really about helping colleagues in those sort of settings with regards the ways of working during COVID, but also where there are perhaps been some concerns in terms of CQC ratings. We've also continued to work with our provider trusts around assurance work for CQC ratings that we have in place. So where we have got ratings, for example, at King's around the emergency departments at both Prue and Denmark Hill, we have continued to work with King's around the measures that they're putting in place to address those concerns. And we are also working with the CQC with regard to the Lewisham and Greenwich Trust, who were having a CQC inspection just previous to COVID, and that inspection will be published. So we continue to work through those different routes. From a quality, so the next slide, from a quality intelligence point of view, certainly at the beginning of COVID, we saw a significant reduction in serious incidents that were being reported. This has picked up, and we are seeing SIs being reported across our organisations. The most frequent reported categories are set out there, so self-harm, diagnostics and falls, and we are working, as we always do, with our provider colleagues to identify causal themes from these incidents. We are also using our soft intelligence routes and our quality alerts in order to be able to identify and act on any early warning signs regarding any pathways. Next slide, please. It's, I think, helpful to sort of set out some of the work that we've been doing with care homes during this period. And of course, this has been very much a partnership approach, as you would expect, working with our local authority colleagues and directors of public health, really to ensure that we have got a collective oversight and approach to supporting care homes during this pandemic. And I have set out there a number of areas where we have worked very proactively and specifically with our care home sector to ensure that they both have the relevant support, training and resources to manage COVID during this period, but also that we are ensuring that we are providing the enhanced sort of health support into our care home sector. The next slide really picks up around continuing healthcare and both for adults and children, young people. So we right at the beginning of this COVID pandemic, moved at pace to risk assess children, young people and adults who are in receipt of continuing care, and ensuring that those risk assessments were across our health and social care colleagues and maintaining people safely in their homes and supporting providers who were caring for individuals in the community during this COVID period. We have had a very robust kind of process around maintaining very regular contact with patients, relatives and families during this time. And we have communicated very clearly with this cohort of patients and families around how they access support and how we are working with them to respond rapidly to any issues of concern. The next slide sets out our safeguarding working arrangements. We were very clear during COVID that where some staff would be redeployed, we would not apply that to safeguarding, recognising that the continuation of safeguarding duties and responsibilities was something that the South East London CCG had a duty to maintain, and we have continued to work through our borough partnership safeguarding arrangements to support around this area. I've also put in some additional structure around safeguarding, so my two directors of quality have taken leadership roles in terms of safeguarding across the boroughs and provided a weekly review of any safeguarding issues with all our designated professionals. We've also been very much a part of the regional NHS safeguarding during COVID cell, and that has also been helpful in providing some oversight in terms of London themes and to look together with colleagues around mitigations for those. And then that last slide just sets out some of the themes and mitigations that we have seen within the safeguarding arena. So we have seen, there have been some concerns around the new birth pathway, so registrations, new birth checks and health visitor checks, and we're working very closely with public health and providers around those. We have seen increases in domestic abuse, and I think people will be well cited that on those, and they have been in the public domain. increases in terms of mental health issues, some reduction in placements for looked after children, which happened early on in COVID, and we sought very rapidly to establish additional foster carers to support that. And then I think as we have as I've touched on in terms of care home staffing capacity and challenges in terms of PPE and IPC. So I think that sort of gives an overview of how we're working. Obviously happy to answer questions.
Kate, thank you very much. Really important that we have continued to ensure that we are, I guess, maintaining our statutory responsibilities as much as anything around the care and the quality of services that people receive. So thanks everyone for those presentations. We're now going to have the opportunity just for some questions from members of the governing body. What I would just flag is that time is inevitably relatively tight, so I'd ask people to try to keep those as succinct as possible. Nada, there are a number for you, so if I could just first of all ask you just to clarify what NRPF means, because members of the audience were unable to understand that acronym.
Sorry, this is no recourse to public funds.
Okay, thank you very much indeed. And then I think Angela, was there a particular point that you wanted to come in and make?
I just wanted to reinforce the point that Nada made about when looking at the data on deaths and numbers of cases, that it does depend very much on how many people were admitted to hospital, because for a long period we were testing only those people who had actually come into hospital. And also, not only does the death rate and the case rate depend on numbers of the total population, but also the demographics of the population. So we have an older population in Bromley, so it's perhaps not unusual that we would see an increase in the number of deaths. But also we have quite a big population in Bromley. In addition to that, of course, we have a number of care homes, almost 60 care homes in the borough, which which may cause a particular slant on the numbers of cases that we have as well.
Thanks, Angela. So, Krishna, I think you wanted to come in with a question.
Yep, it was partially answered by Angela, but just looking at the number of cases between the boroughs and also South East London with other boroughs outside South East London, but specifically the Greenwich rate has been quite high. It's nearly 30% death rate, 600 plus cases and 200 deaths. I can see the coding, the testing and all those confounding factors, but Greenwich is not that old population and things, not as many care homes and things like that. Just a point to make that if there is a second wave, if there are any lessons to learn from this and put things in place, it would be good.
Thanks, Nada, and then Angela, you may want to come in as well.
Yes, in terms of death, I've just went back to check Greenwich. Greenwich, in terms of death, is sort of in the middle, so it doesn't look so bad on the slide. But again, I have to reiterate what Angela said. It's very difficult to compare these deaths at the moment, because it depends so very much on testing and confirmed cases and confirmed deaths. So if you, now I can't go back to one of my slides, which is national data. These are based on testing confirmed COVID, so that we know definitely that somebody did die from COVID. The other thing that we always, and this is not only COVID issue, this is the issue with other conditions, is how correctly something is coded. When a death, so is it a first cause of death, is it contributory, second or third or whatever. So I'm quite, I wouldn't actually interpret this data on death, yes, in terms of saying one area has greater number of deaths or not. And obviously these are not rates. It very much depends, Bromley being the largest borough, so obviously that will skew the information as well.
Thanks, Nada. And Jackie, you had a question for Nada, I think.
Yes, thank you, Nada, for the public health report. I wanted to raise a question about slide 9, really because there's been a lot of evidence from research that a particular community, the Black, African, ethnic minority, Asian community, seem to be disproportionately affected. And whilst we don't know the reasons why, there does seem to be repeated evidence showing that up to 4 times a greater risk of death from COVID. And I guess looking at slide 9, I don't see that feature, although we can see that perhaps BAME communities might span the 3 sectors that have been, the factors that have been set out. But I do feel it's important as a CCG that we call out specifically as an independent risk factor ethnicity, BAME ethnicity, because we have a significant BAME proportion of our CCG and provider workforce. We also have a high BAME population across SCL. And I think it would be important for us to call out the independent risk factor, whether we know the reasons or not, and also because subsequent conversation about actions and interventions would then also help us to particularly target resources, target support to this community, which may have a number of risk factors all joined in together. We know that there's independent risk factors for increased morbidity and mortality in this group. And so I'm just anxious that we've not called it out as a CCG or public health in the way that it perhaps I feel it should.
Thank you for that. Yes, absolutely, I agree. I think the reason why it's not specifically mentioned in any of these boxes is because all of this could apply. This is potential impact. So I think, unfortunately, that all of this in terms of health, social, economic impact could equally apply to all of these categories, to BAME groups. On the slide, I think it was, I can't remember which number it was, when I talked about public health actions in terms of community support, and I don't think I've probably, I haven't done justice to what colleagues have told me, because I've summarised everything from the 6 boroughs who told me what they were doing. But I think there is a lot of work that's been already done in terms of firstly looking at the impact it's in Southwark. They've been doing, it's been actually developed a rapid impact assessment to look at vulnerable groups, specifically BAME groups, and what could be potential impact. Similarly, Lewisham, which I mentioned, the work that Catherine Nadeva, the Director of Public Health, is leading on, and she provided quite a detailed update on what they were doing some joint work with Birmingham. So that is quite a big piece of work. In Lambeth again. So I think across South East London, we are looking into both looking at the impact, developing the risk assessment tools jointly with our both local authorities and other and the CCG place-based structures. So I think, although we specifically didn't mention it here, that the amount of work that's happening already, even at looking at and assessing the impact, is quite large. But I take your point. I think obviously this is something we really need to look at seriously, and because what we are seeing now, although you're right, we still don't know why. It could be various reasons why we see this disproportionate proportion of deaths in this group. But probably as we do anything, we firstly have to start with really good impact assessment and risk assessment of individuals and particularly, let's say, health and social care workers, and understand that that's already what's been happening across South East London.
Thanks, and I'm aware of time. So Jackie, I think because we've captured if you want to do a follow-on, but we've definitely also captured your point that we need to be more proactive on this. Was there anything you wanted to say finally? But I do want to get to other questions as well.
It's about the degree of impact, i.e. mortality, and the need to specifically call out and invest in support for this community around the long-term conditions that may be fully controlled, as well as other factors, specific investment.
So I wonder whether, as an action from this, so Farouk is obviously on the call, and we should be bringing this to the meeting of our equality group as a CCG. But I wonder whether we might also, Nada, I don't know whether this is something you'd be prepared to take on, but just capture the work that's going on in individual boroughs so that we have a bit of a sense of what is going on at the moment. Because I think it'd be very helpful for the governing body. Obviously, all of us are working in our individual boroughs, but it might be helpful as a first step to also just capture the work that is happening. Because I think Jackie's quite right to emphasise this, and I do want to make sure that we capture her point. And we will undoubtedly come back to this again. So thank you very much. And that could perhaps be shared with the governing body after the meeting. And I know there have been questions from the public on this, so I think it would also help inform the responses to some of those questions from the public as well. OK, so I've got a question from Mary as well. Mary.
Thank you, Jonty, and thank you, Nada, for your presentation. I just wondered if you could say a little bit about how the South East London public health teams are or will be linking in with the national track and trace plans.
Thank you, Mary. Yes, actually, this is of course our new big programme, which will start next week. Unfortunately, there has been very little clarity in, or very little details, but what we've know now is that there will be two big areas that local authorities generally and public health will be involved. The first one is to support Tier 1 Public Health England service, which is specialist public health service, and that is what we would say standard public health work in management of complex outbreaks. And this is something that we do already, but not maybe not in relation to COVID so much, but we will continue to do that. Then there is another area of making sure that people who are identified as contacts from vulnerable groups and maybe cannot, will find it difficult to self-isolate or have problems, that they would make sure that they are linked to the community hubs and to support they can receive. Another big area that what public health teams will be involved in is, of course, as we usually are, is the data. What we will be asked to do, and we've started to plan for that, is develop data hubs and to manage both to have the information on tracing, but also to generally start to do much more surveillance, local surveillance on COVID. And then there will be, I think, the really important thing, which I think is important for the governing body, is the general link both with the colleagues in the NHS, primary care in particular, and community services on one side, and then on the other side, all the local authority services, social care, housing, because we may see all kinds of issues when we are starting to look into vulnerable populations, in particular homeless people, people in temporary accommodation. How will that be managed in terms of contact tracing and self-isolation and support for those?
Thanks, Nada. I wonder whether I could just ask Andrew Parson has a question on childhood immunisations. Would you like to come in, Andrew?
Thank you, Chair. Thank you to everyone for the excellent presentations today. Nada's presentation raised some very important impact on other areas of health on our population, and the one I would like to highlight would be impact on the delivery of childhood immunisations. As you know, Chair, many of us and many agents have been trying to promote and improve childhood immunisation uptake even before COVID. I am concerned, obviously, if these rates are dropping. Are we able to track that? And secondly, are we going to be taking some action to ensure that we recover if necessary and go on to improve childhood immunisation rates?
So, Angela, I didn't know whether you might want to comment on this specific question around childhood immunisation.
Yes, thank you very much, Jonty and Andrew, for the question. Normally, when we're looking at immunisations, the data is about 6 months behind the actual immunisations, so it's actually quite tricky to get very accurate data, but there has been an audit done across London comparing April just gone's data with April 2019. And in some areas, it does look like there has been a reduction in the number of childhood immunisations undertaken. But part of this may be a data quality issue. I don't think that's the case in South East London, and I can give some reassurance that although vaccinations have dropped a little bit, they are maintaining a certain the level that we would hope they would across South East London. That does vary a little bit between vaccinations, and it does vary a little bit between boroughs. So if we look at South East London as a whole, we've seen some quite interesting data. So the first 6-in-1 vaccination that babies get, we're seeing a little bit of an increase in the uptake in the first year, and that increase is reflected as an increase in Bromley and Southwark particularly. So we will be looking at this in more detail, but the data that we've got at the moment needs a little bit more analysis. Having said that, there are some actions being taken around this. There's a public campaign that was launched earlier this month to encourage parents to come forward for vaccination, and certainly I'm sure everybody on this committee would want to endorse that message to parents. To bring their children forward for all vaccinations. There is an immunisation commissioning team at NHS EI, and they're working with our local teams to look at what needs to be done, not only at a borough level, a South East London level, but also a practice level. And action plans are already in place by borough, but these will be strengthened. And there's going to be some deep dives undertaken on how we might further improve the delivery of vaccinations. So this is a very live issue and we're very actively looking at it. So we can certainly keep the committee informed as we go forward.
Thanks, Angela. Yeah, that would be excellent. I think last questions on this are for Falake. Falake, I think you have a couple of questions that you've asked to you've requested to ask. So do you want to do that now?
Yes, please. Thank you. Well, I guess my first question is really about mental health. Each of the speakers identified that there was going to be an expected increase in the demand for mental health support. So my question really is, we know as Health Watch that people have regularly fed back about long waiting times and access prior to the lockdown. And so I guess, so what is the current demand and take up of these therapies, and what really is going to be put in place beyond an online option for people going forward? And then my second question is, complaint processes have been suspended during the pandemic. So I'd really like to know what has been done to address concerns of patients and their family in a systematic and accountable way. Thank you.
Thanks. So there are different parts to that, and I suppose so. One element, I don't know whether Nada or Angela wanted just to very briefly speak about the mental health impact of the pandemic, and then I'm wondering whether Nancy might want to comment on the way in which services are being provided, and Kate, obviously there's a question here about complaint procedures as well. I hope I've captured the key elements of it. Should we go in that order? Nada or Angela first?
Thank you. Shall I just start?
Yeah, do.
In terms of impact, obviously the isolation and loneliness that people may feel being at home more will have an impact, definitely. And it's a question for those who are more vulnerable, those with pre-existing conditions. It could be even worse. We mustn't forget, of course, bereavement, because we know that we were talking about death from COVID. So many people, unfortunately, would have lost their loved ones. So that is the bereavement, and bereavement services is something that we also have to look at, not, I think, only mental health services. And I would also highlight the issue of health and social care workers, because we know that they have been put under enormous stress, and particularly those obviously dealing with COVID cases. So we do need to think how we support our workforce in this really stressful elements.
Thanks. And I guess just in terms of the services, so Nancy, I didn't know whether you wanted to comment, and then actually we'll ask Christina just to say a word or two about complaints. But Nancy, did you want to comment, and then Martin may wish to follow up on that?
Yes, thanks, Jonty. So I think the question was specifically about waiting times and whether there was a sort of approach to that. And I can't give you that answer. I don't have enough detail, I'm afraid. But what I'm aware of is that none of the community services in mental health, as far as I know, closed. They changed the way that they operated so that they offered a virtual offer, which I know means that there's some people in the community who don't manage to access that. But I know, for example, that IAPT made a huge effort to offer virtual consultations. Overall, though, I think in the same way that we've seen other hospital referral numbers go down. Sorry, there's obviously a King's helicopter going over my head because I'm in Peckham. We'll just wait for that. Yeah, I mean, I think hospital referrals have been going down for obvious reasons. I think mental health referrals have as well. So there will be a backlog. I'm aware that SLAM, again, I'm closer to that trust than the Oxley's community services. I know that SLAM's done a lot of review of the changes it's had to put into services. So they've reviewed things like the notes of people who were discharged during the kind of very intense hospital discharge period at the beginning of the pandemic. So I think there's been quite a lot of awareness of the impact of that. And I hear about the need to reassess the population need and the wellbeing need of staff over and over and over at the moment. So I don't think it's being ignored. I feel quite positive how much of a high profile it's got. So hopefully we'll get a good sort of plan in the next few weeks from that.
Thanks, Martin. Did you want to add to that at all?
Only to say that both trusts have been contacting patients that are on their lists by phone or video conferencing and whatever.
Thank you. And I do recognise, Nancy, that this does have a high kind of priority. I think one of the things that we are continuing to find is that as part of this recovery process, the work that's happening very, very actively at the moment is to understand the exact impact, and that will allow us to plan services to ensure that we can meet the needs of those who perhaps haven't been able to access care in the way they would have wanted in the next phase of the pandemic, and that's something people are actively involved in. So it's something I think we should come back to as we get a clearer picture of exactly what impact there's been and how we're then going to be able to adapt services to ensure that they can meet the needs of patients. I just wanted to, Christina, so there's a question at the moment around the extent to which the complaints process has been stepped down, and how we're adequately capturing, therefore, I think I'm right in saying, for like we're right in capturing feedback and concerns raised by members of the public. Did you want to say anything on that?
Yeah, thank you. So it's a really good question. So we obviously, as part of the national response and focus on COVID, a lot of the complaints processes were paused. In terms of anything that we get, though, as a CCG, we are absolutely having conversations with providers and others to investigate that. I should say, in terms of what we have had through, there's been very little, actually. We've had quite a lot of sort of MP inquiries and things related to COVID, but we haven't really in this period had much in terms of broader complaints. But just to provide reassurance, we absolutely would ensure that those were logged, that if it couldn't be investigated at this time because of the focus on COVID, that it was revisited and there was a response and dialogue with whoever had made that complaint.
Great. It sounds like that helicopter just reached you. So I think if what's really interesting is that actually this way of working is meaning that we are getting a number of questions, and it's been fantastic and a really rich conversation. I'm sorry to close it down at this point. I think we can absolutely pick this up again, and we'll continue to as a governing body and ensure there's the opportunity to do so. I think it would be interesting to work closely with public health to look at some of those mortality statistics, to understand the extent to which they might be related to particular demographics within our population, to think with our equalities group about the extent to which the characteristics of our population are potentially driving further inequalities into South East London as a result of the pandemic, and how we respond to that in the next phase of the pandemic. And importantly, I think ensure that the governing body can understand this more deeply, perhaps through a sort of seminar in the near future with public health colleagues. So I think there are some actions that we need to take off the back of this, and I hope that will pick up some of the concerns that I've seen being raised by members of the governing body during this. Of course, we can also, outside of the meeting, pick up any further concerns that people have. I'm going to come to Andrew in a moment, but I do want to play these videos at this point. So if we can do so, that would be. Just 1 second, because I think we may have cut you off. Martin, did you want to finish saying anything? I do apologise.
Thanks, Jonty. No, sorry, I started to speak when he introduced me around mental health. The only thing I was going to add to what Nancy said a few minutes ago now was that both trusts have been contacting patients that's known to them regularly throughout this period by phone and video to make sure that everything's okay with them in terms of their current mental health state. So I think it's, but I know the questions also about future demand as well, which I think we have answered. But I just wanted to give assurance that regular contact has been made with those known to services.
Fantastic, thank you. And I think one of the helpful things about this kind of conversation is that we're also starting to frame what we need to know and understand about the next phase of the pandemic. So I really appreciate that, and also would want to recognise that a lot of this work does take place in boroughs, and what's really important about the way in which we operate now as a CCG is that some of that work that goes on in local boroughs, both with the voluntary and community sector as well as statutory services, will absolutely pick some of that up. And I think I flagged an action earlier to understand what is happening, particularly around the BAME population, but I think it'd be really helpful to understand what is happening in local boroughs as well in response to the pandemic. So could we play the videos, and then I'm just going to bring Christina in very briefly, and then move to Andrew for his report.
Hi, I'm Cass Rhodes. I'm one of the pharmacists from the South East London CCG Bexley area. I'm a prescribing and pathways advisor. So I'm currently on redeployment. I'm doing a slightly different role, working at home, as a lot of people are these days. I'm actually helping the GP practices by reviewing their e-consult forms, which is an electronic prescription request. We're focusing within our team to look at those that have a repeat medication that are coming in from patients, just really to take some of the administrative burden away from practices, having to learn to use new systems like Vision 360. You can see behind me, I've just got it blown up on my screen at home to make it a little bit easier. So I can log into patients' records, check that the requests are appropriate and what they actually need, allow the GP to take that bit of burden away, takes the burden off the administrative staff in the practice, and then the patient can go to the pharmacy and pick up the prescriptions. So obviously sometimes we have to involve our GP colleagues or clinical colleagues to look a little bit deeper into what that patient is asking, because sometimes patients want something they've had years and years and years ago. There's no clear indication for it, so it needs a bit more of a clinical scrutiny. But it is quite useful. It's a very different way to work. I'm still doing our normal medicines management work on the side, so it's like an additional role, but it's quite useful to learn new systems, help other people reduce the burden in practices who are quite swamped at the current time with anxious people and people wanting their medicines urgently, and just to keep everything going, keep everything nice and calm. I'm quite enjoying it. It's a bit isolating, but it's good to learn new skills and working with the team virtually, which is quite unusual, but we have a nice phone chat every day about 9:30 to keep everyone on track. But as far as I'm concerned, the redeployment's been quite useful. It's given me a new aspect of the role, new aspect of using my knowledge in a different way and helping, and that's something I enjoy to do. So if you're thinking about being redeployed or about to be redeployed, just don't worry about it. It's really worth it and it's a good experience. Bye.
My name is Natalie and I work for the South East London CCGs. I've been currently redeployed to the South London University, where I'm acting as a host. My previous job with the CCG was as assistant locality manager. I really enjoy my new role here, and I would recommend for everyone to be redeployed and integrate.
Hello all, I hope you are well. I'm Teresa and I'm part of the Communications and Engagement Department. During the COVID-19 response, I have been redeployed and I'm currently supporting the GPs in Lewisham. I'm doing this by helping them to contact a number of patients that are classified at high risk. And with these phone calls, we are ensuring they have enough food and medication for the next days. If they need support, then we put them in contact with the local services available. We are also taking the opportunity to check their well-being, if they feel safe, how they are emotionally, how they are coping with this time of isolation, and if they are keeping active and exercising. We have some resources for them if they need to. If we flag anything, of course, we pass the information to the central team, One Health Lewisham, and there they will do the follow-up. In general, it's going really well. Patients are happy to be contacted and supported, and they are very grateful to the NHS. They keep passing those messages of thanks to us, so I'm happy to pass that to you now. And personally, for me, it's also very pleasant to be able to help them. And many times they also ask me how I am, so I can share with them my feelings and how I'm going through the day and through these maybe strange times like we are all in now. So yeah, that's it. It's very interesting. I'm learning, and I hope you are well and take care, all of you. Bye-bye.
In response to the COVID pandemic, primary care have focused their efforts to support increased numbers of Coordinate My Care plans. This including primary care clinicians completing these with patients, CCG staff supporting patients and practices, or patients doing this themselves online. This has been driven by primary care, and two GPs, Dr. Clive Angiansa and Dr. Leslie Ball, highlights how valuable this has been.
Coordinate My Care has enabled us to engage with patients, if they are ready, in the discussion about their future care. During this time in general practice, we found it an invaluable tool in advanced care planning and helps our most vulnerable and frail patients let us know what they want.
We're using CMC care plans to make sure that every service that comes into contact with our patients, 111, care homes, palliative care team, ambulance crews, all know how and where our patients want to be looked after and what treatments are right for them.
In 2020, general practice is still one of the very few remaining businesses where you still have to physically attend in person to become a customer. And by that, I mean, we're past the days of walking into a bank and opening an account, right? In light of COVID-19 and with a practice dispersal pending in Bromley, it was more important than ever to work with our practices to establish a digital online registrations process for patients. The outcome of this piece of work has been that over the past 8 weeks, all practices have been enabled to register patients digitally, which has allowed over 1,300 patients to re-register with a new GP, and some have been able to do so without leaving their home.
Here in Greenwich, we were able to rapidly develop our existing Live Well social prescribing service, which is delivered by the Charlton Athletic Community Trust, into a responsive and flexible community hub. The hub was able to increase capacity in the first 2 weeks of the pandemic from 24 phone lines to 50, with all staff working from home. Many volunteers also came forward to offer much needed support in ways in which we could only ever have imagined. For example, they were delivering food parcels, prescriptions, and making regular friendly calls to our most vulnerable and shielded patients. Our patients were also able to access key services and support such as bereavement services, smoking and alcohol cessation services. And the hub has made over 45,000 calls so far, as well as over 5,000 referrals. And we continue to respond to the diverse needs of our community as the impact of the pandemic and the lockdown continue to emerge.
The risk of COVID-19 to the vulnerable homeless population was recognised when the government instructed local authorities to bring everyone in. This described a triage model for GLA hotels to cohort and manage the risk to homeless people. We rapidly mobilised support to 2 hotels in Lambeth and Southwark, accommodating about 300 people, using 2 practices in Lambeth, 1 in Southwark, offering registration for the significant numbers of unregistered. Access was mostly through telephone, video and online, supported by on-site staff and working closely with the health inclusion team, mental health and addiction services and GPs from the pathway team, supported by regular meetings at borough, STP and London level. The integration of housing, health, care and voluntary community services was a crucial part of how this has delivered a remarkable improvement in the health and well-being of a group of vulnerable citizens. And we're now developing the next steps to build on this towards permanent accommodation.
During these difficult times, care homes in the UK and across the world have been particularly hit and affected by the COVID-19 crisis. To help mitigate against this, One Health Lewisham has been supporting homes and GPs with IT equipment, allowing virtual access to the patients, as well as more efficient virtual assessment of the patient using kits, oximeters, installing these in the homes with training and guidelines and protocols. Proactive care planning for our patients and homes has been incredibly important, and building on work that's already been done, we've managed to recruit a nurse consultant in palliative care who is helping us with helping our GPs with this constant endeavour to strive for 100% of our care home patients to have a CMC care plan.
In response to the onset of the epidemic, we quickly came up with an agreed pathway with supporting template in Southwark for proactive management of patients at increased risk of COVID infection. This was well received by healthcare professionals, and we've coded 3,700 proactive reviews to date. Many of my colleagues report appreciating some guidance and structure and have quickly moved well to remote consulting. It's time consuming to do properly, but immensely satisfying. Patients seem to really value the input, and it gives us the opportunity to support them to optimise the care of their long-term condition, to access social support should it be needed, and to discuss advanced care planning if that's appropriate.
Communicating well with primary care staff has been really important because the pace of change has been so fast. We quickly set up a number of ways to ensure that they have the key information that they need. Twice a week, we've been sending a special COVID-19 bulletin with the latest updates. We've also set up a GP broadcast group on WhatsApp, which now has over 600 members.
With colleagues across South East London, we were tasked to set up a website for GP teams to collate the emerging evidence for not only the management of COVID during the pandemic, but of the non-COVID presentations we were seeing. Please go to the website gp.selondonccg.nhs.uk.
I hope that many of you have seen that GPs in South London now have a resource to aid advocacy and complex decision making for our vulnerable patients. There are also 2 layers of support, a professional conversation with a fellow GP and a daily mental health and ethics forum where your cases can be discussed if needed. This came about because South East London wanted to ensure that you had the same level of decision support as available to hospital colleagues. I loved leading this collaboration because it brought together such a great variety of people whose skills were all focused on a practical and useful resource. So thank you to Healthwatch, SLAM, St Christopher's and ARC South London, but most importantly to South East London GPs, because you all made it fun. My hope is that this kind of integration and collaboration becomes our new normal.
Thank you very much for sharing those videos, and whilst I recognise that technically it's still quite hard for us to show all of the incredible work that's going on, I certainly am quite touched both to see the way in which staff have adapted to new roles and really participated very fully in our response to the pandemic across South East London, and I hope we can minute our thanks to CCG staff as a governing body for that, but also to see the incredible work that's going on in the boroughs. And I think Natasha was spot on at the end there in talking about the way in which people have been able to collaborate. I think what I would also call out is that from my point of view, this absolutely captures the value of a CCG that can essentially work at South East London level, but continue to value the incredible work that's going on in boroughs. And we would never have been able to respond to the pandemic in the way that we have if it weren't for the individuals and the organisations at borough level who've been working on this. The response that you've seen was absolutely incredible and continues to be. So I think huge thanks to those working in boroughs for that as well. And important, just I think we wanted to try to ensure that the governing body as a whole is aware of all of the work that's going on in that space, and we will continue to try to bring examples from across South East London to the governing body to ensure that we're all up to speed with the incredible work that's going on. Could I just ask Christina to say a word, and then Andrew, I will come to you. I'm sorry that time is going to mean that everything becomes a little tighter going forward.
Thanks, Jonty. Just very quickly, and we're getting lots of questions in the chat, which is fantastic. So I just wanted to clarify for people. Obviously, we cannot respond to questions as we go through this. We have got another Q&A session at the end where we'll be able to answer sort of 3 or 4 questions, but we are taking note of all of the questions that are coming through and we will respond to you after the meeting. So apologies that we can't do it throughout, but thank you very much for engaging so thoroughly.
Thanks, Christina. So Andrew, to your accountable officer report, and I was really pleased that obviously this also picks up the work going on in different boroughs, but I wonder whether you wanted to say a word or two and then we can open to any questions governing body members have.
Thank you, Chair. I won't take too much time to let the report as read. Just a disclaimer, my expression on the photo will remain the same in respect of the content of the report going forward, so my apologies for that. I only wanted to reiterate and hopefully reiterate my thanks for the efforts of all of our South East London health and care services, and indeed the lengths residents are going to in response to the pandemic. And I hope this report picks up a little bit of the very local flavour to that. Some of the learning and repeated experience I see is that at every population level you're seeing new partnerships make innovative responses. So a huge thanks. And I should also say, I won't repeat anything that's gone ahead in the previous agenda items, but our gold team and silver and bronze and those members of CCG staff, when we talk about thanking them, that they are working around the clock for a lot of the period. We've just gone past 7 days a week, and I think it's a lot more than a call a day. There's several that go into, so thank you. The rest of the report really captures some of that local flavour. I did want to make sure recorded formally, because clearly we have not seen it appropriate to have any other form of launch in a lockdown period, the instigation of the new CCG, and I thank everybody involved in that coming about. And of course, my report also records some of the appointments we've made. It also records some of the appointments we haven't made. So clearly I attended the predecessor CCG governing bodies in March. And at that time, it was literally at that time, we were approaching a lockdown period. And so consequently, we have taken as an executive team a number of decisions about those things that are business critical for a statutory body to undertake, but equally taking decisions on those things we might stand down to focus our response to COVID and the pandemic, along with all of our other partners. So just to flag that, as a result, that means that some of our plans work into the new CCG has, as you would expect, been suspended. And I think some of the opening questions for this meeting alluded to a couple of the delays that you find within that. Other than that, Chair, I will clearly, if there are any questions on this report, on this occasion, it's a report that draws in a number of our borough leaders, so there may be questions for them as well. But I hope it's helpful, and going forwards, and depending on changing times, and we will seek to give this type of flavour to our governing body meeting accountable officer reports.
Thank you, and I think a great appreciation. I think definitely in both the opportunity to have photos and particular reports from the boroughs. I think that's great. Can I ask if there are any questions from governing body members for Andrew regarding the content of the report, or obviously for any of those directors at borough level who are also in the meeting? I recognise that for the most part you'll all have very close relationships with borough directors, so it may be that there aren't, but any particular questions that people wanted to raise? Okay, Andrew, in that case, thank you very much indeed for that report. Hopefully that's helped catch up a little bit of time, and I'm hoping that the next item will similarly, because we do always receive a report on the CCG Prime committees, and I'm not really looking, Christina, for a detailed output because people are involved in a lot of those committees, and it's mainly to update the governing body on those decisions that have been delegated to those committees. I'm not aware of there being any decisions that the governing body is being asked to make in relation to this, but would you like to just say a word or two about it?
Absolutely, I'll be super quick. So you're right, we have had a few committee meetings. Audit has met, primary care has actually met since this report again a second time, and the REMCOM has met a few times in order to address some of the things coming out of our merger programme. So just to say, there are no recommendations or asks for decisions at this point. There are a couple of things which we will be taking to the second part because they relate to sensitive information, but otherwise the report just recaps kind of the purpose of the committees and some of the key actions. So really just to note and hopefully taken as read.
Thank you. Recognising you're absolutely right, there are a couple of decisions that will come to a private meeting. Are there any questions from the governing body for Christina or the chairs of any of those prime committees? Okay. Yeah, sorry. No. Okay, great. Thank you very much indeed. So Christina, actually, I think you are next up as well. Do you want to introduce the corporate objectives for the CCG?
Sure, absolutely. Thanks, Jonty. So I think best just to dwell on the summary slides, if we're going to show them, Simon, or the third slide in the pack. So in terms of the approach that we've taken, obviously, again, something that has been impacted by the lockdown and our need to focus on COVID-19. However, we are keen to make sure that we have a clear set of corporate objectives for the organisation. These objectives relate to the financial year, and we will go through a process of reviewing and revising them. Through the year, we will look to make sure that we are obviously making progress on these. In terms of where we've got to, we've discussed these with the governing body and come to a set of 8 objectives which we would like to use. What we have done in the pack, I won't go through the whole thing, but basically to sort of try to outline what the sort of activities and objectives we would have in a normal business as usual year, but also some of the things that we need to consider in light of the fact that COVID obviously has been a huge level of focus to date and will continue to be certainly for the rest of the financial year. So it feels important to make both of those distinctions. This paper is brought here for governing bodies' formal support, and were we to get that support, we would then look to engage with different leads for each of these objectives to build a plan around them. We would be looking to engage with our members and others to share these further and develop our response to them, and we would clearly be bringing that back to governing bodies in the future to report on our progress. So as I say, in terms of the, thank you Simon, so in terms of our main objectives, they're on screen at the moment, and they cover improving health. Clearly we need to make sure that we are commissioning services which meet the health and well-being of all of our population and critically reduce inequalities. We need to focus on quality, and that includes safety as well, but also safeguarding, which is one of our key statutory responsibilities. We've got a couple on system and service transformation in terms of working with our partners. Hopefully those watching also know that we are part of the Wave 3 integrated care system. So we actually don't just think as a CCG, we are thinking all the time about what we need to do with our health and social care partners in particular, and making sure that we continue to develop both the culture and approach to doing that, and increasingly do more and more of our both transformation and our sort of business as usual activities with partners. Critically important, and hopefully today has been a good example of that. We want to continue to ensure that we involve as many people as possible. The ability for patients and local people to participate in what we do and importantly shape that is a really fundamental part of our ethos and principles. And we also want to recognise the need to make particular efforts to engage with those from diverse and seldom heard groups. We also want to, we are a membership organisation, and clinical leadership is critically important to everything that we do. So we make here in commitment number 6, or objective number 6, the commitment that we will embed clinical leadership across all of our ways of working. Our workforce is the backbone of what we do. And so we want to ensure that we are empowering our workforce to be able to support us in delivering our objectives. And also the final objective just refers to the fact that clearly we have a number of financial performance improvement and statutory responsibilities, and we will do everything that we can to ensure we meet those whilst maintaining effective governance both within and outside of the organisation.
Christina, thank you very much indeed. And obviously, I, alongside other members of the governing body, have been a part of developing these corporate objectives, and it's been incredibly helpful. We've had at least 2 seminars, I think I'm right in saying, thinking about these and how we try to ensure they reflect both our ambitions as a CCG, but also the very current context that we find ourselves in. So I really appreciate the work that's gone into developing these. Are there any final sort of additional questions on the corporate objectives, or are we happy to sign these off as a governing body? Can I ask for any questions first? It's kind of reassuring given 2 seminars, but okay. In which case, rather than ask to sign off, can I hear from anyone who isn't content to sign this off? Excellent. In that case, Christina, I am very happy that the governing body supports those, and important now that we obviously engage with directorates and the staff around those corporate objectives, and I will also be talking to clinical leads about how we pick some of those up and contribute to progressing those over the coming year. Thank you very much, and thank you for the work that went into to developing those collectively. Okay, so I think we now move on to an item on finance and planning, and I think we will hand it first to Usman and then to Sarah Cottingham, I believe. Usman.
Thanks, Jonty. I'm conscious of the time, so I will not go through every page on this slide. I'll take the document as read and then just go through some key messages. And then if members of the board have some questions, happy to take those. So just the key things that I think are important for people to note. Annual accounts, 2019 for the 6 sort of predecessor CCGs or the legacy organisations, all 6 CCG accounts were submitted on time. Despite the sort of new ways of working, we managed to do everything remotely. So I really just wanted to say thank you to the whole finance team, because it was a real effort. It was doing something very different, but all 6 accounts were submitted on time. The auditors are currently in place at the moment and reviewing the papers, but we've had no sort of issues raised, no significant concerns. I've had positive feedback about the sort of process and the papers and the working papers we've pulled together. Just to formally confirm, all 6 CCGs delivered their control total. In fact, we were slightly better than control total, 359k across the 6, about 50 or 60k for each organisation. And that was just as we worked through the final account. So really good result there. And again, thank you to everybody for all the hard work that's gone into allowing us to deliver the closing set of accounts on time and on budget. And hopefully that sets precedent for how we will go forward as a new CCG. As well as the accounts, I just also wanted to highlight the fact that we've merged, and while the sort of organisational merger has happened in the background, the finance teams have been working through quite a complex piece of work to merge the 6 finance ledgers, the systems, payroll, and I think it speaks very much to the finance team's credit that we have managed to get all of that done and get the accounts done, and no issues were raised. So we had the close-off meeting happened this morning, yesterday afternoon even, and I think it's just worth noting that the feedback from Nick Atkinson, who many of you will know as the senior partner for RSM, was that he felt that the merger project that we ran was the best project he'd seen run from a financial integration point of view. And I did just want to call out, I mean, it was a whole team effort and lots of people helped, and everyone in the finance team department was involved, but in particular I just want Julie Witherall really helped lead that process, and just want to formally note my thanks to her through that process. So good result on the accounts. We've done well in terms of getting the merger in place. The new finance structure is also live. Clearly we had been intending to put that in place after the accounts were done anyway, but as of the 1st of May, the finance team is now working as a single finance structure with central teams, opposed to borough-based teams. We've had no sort of negative feedback on that. I think the process has been in place, it was well communicated, and we've done lots of engagement with people so they knew who they needed to go to. So that's those 2 points. I think the other key thing just to highlight on here is clearly we were well under the way of sort of budget setting and preparing our budgets prior to COVID happening, and we had produced draft sets of budgets. And I think, Simon, yeah, if that's the slide, thank you. What you'll see there is in effect based on the set of financial assumptions we had, largely agreed through the long-term planning process, but refined during Q4. We had come to an agreed position that encompassed sort of most of our agreements with providers. There were some caveats to that, but largely we had agreed our positions, and internally sort of for all our other budgets we had got to an agreed position. However, as clearly we'll all know, the COVID situation happened and we haven't been able to load the new budgets, and partly that is because a couple of weeks ago the national team issued new guidance for CCGs. So at the start of this process they had issued new guidance for providers, but a couple of weeks ago they issued additional new guidance specifically for CCGs, and some of our allocations have changed. The way we're going to be sort of paid for the first 4 months of the year has been adjusted in line with the way trusts have been sort of had their budgets changed. That is all being worked through at the moment. So I think there will be some changes as a result of what the new national guidance says, and we're working that through at the moment, and we'll be in a position, I think, to share that with sort of board members and executive colleagues later next week, and we'll bring that back to the formal governing body as and when we get confirmation of what all those will mean and what that will mean for our overall budget. But it was just to sort of, I think, highlight and give assurance that we had been doing all the normal budget setting process. We had worked to have a single CCG plan, and we did have it, but it is now sort of on hold and being revised as a result of the new guidance from the national team. In terms of sort of the other key points around our 2021 position and plan, we don't historically report month one positions, and we aren't this year, and both the national and regional teams were clear that they were not looking for month one reporting. We have, however, continued to monitor our costs as we have sort of been getting them in and trying to keep them in line so that we're not losing track of anything, but we will revert to full financial reporting in month two, and we'll share that with governing body as normal. In terms of the one thing I did just want to highlight in this document, Simon, if you can just slide forward onto the net risk position. Thank you. Clearly, this net risk position was done at a point in time prior to COVID. And based on the new national guidance that's come through, some of these risks will no longer be relevant and some will still be relevant. But I think it's just worth highlighting that based on where we were prior to the COVID pandemic starting and impacting our positions, we had identified a net risk position of about £20 million going into 2021. And some of those sort of details are sitting there. I think it's worth highlighting them because I think some of those will still be an issue. And I think we need to recognise that we start the year with a sort of unbalanced risk position. So we've had not identified a full set of mitigations to cover off the risk that we had identified. I mean, at £20 million, it's significant, but it represents a relatively small component of our overall sort of £3 billion budget. But once we move into a sort of proper reporting again, we've worked through what the national guidance is, we will update our risk tables and take people sort of through what we think the mitigation plans will look like, and we will work with executive directors across borough directors and central team directors to work through potentially what our savings requirements will be as we go forward. I highlight that just because I think in the current environment, rightly, the focus hasn't been on finance, it's been on making sure our response to the pandemic is right, and we're doing everything to protect lives and keep people safe. But as we move forward into the next phase of this, we will clearly need to think about the financial implications of some of the things that have happened and where we might need to consider savings to live within what will clearly be constrained budgets as we go forward. I think, Simon, if you can move on to the next slide, please. Yep, so just in terms of COVID specifically, so while we haven't been doing sort of formal month one reporting and we haven't been required to submit formal financial returns, we have been keeping track of all of the COVID related expenditures. So the slide there that you should hopefully be seeing sets out that for 1920, so largely in March, we incurred as a group of CCGs approximately £647,000 of expenditure, all of which we've had reimbursed back to us from the national team. And based on sort of the decisions we've been making, some of the costs that we believe we're going to incur, we think at present our full year costs related to COVID in 2021 will be about £6.8 million. And we have sort of let the NHS E&I national team know. We're in discussions with them to work through some of the questions that they've got. Rightly, there are just checking that all the things that we've listed on there are sort of valid COVID related costs. But we should receive that funding in the course of the next month or so, and we will keep you all updated as we change the forecasts based on actual spend coming through. In terms of COVID financial governance, I think we recognised early on that we couldn't allow sort of any delays in financial governance to get in the way of people being able to make the right decision, people being able to put in place the things they needed to. So we quickly set up a slightly revised financial governance that increased limits for certain people, but also gave authority to the Gold Command to make expenditure approvals in excess of £50,000. I think the process has worked relatively well. We have Gold meetings every morning, and confident in saying that I don't think the financial sort of governance side of this has been in any way caused any delays to things. Clearly, we'll keep that financial governance arrangement in place as long as we remain at sort of level 4, level 5 pandemic response. But as that is lowered, we will clearly revert back to our standard financial governance and reintroduce the standard SFIs and work to those rules rather than the updated COVID financial governance. I'm going to leave it there and take questions.
Thank you very much, Usman. That's great. Sarah, I didn't know whether you wanted to say a word or two before we open to questions on some of the contracting at the end of year and this year. Did you want to come in?
Yeah, I'm happy to say a couple of words. I mean, Usman's referred to the fact that planning and contracting was essentially put on hold as we went into the pandemic. We had agreed contracts with the vast majority of providers. Lewisham and Greenwich Trust was the only outstanding contract, although we had agreed a huge amount with them, just not finalised the whole contract. We have done a bit of work to codify all the agreements we had reached. So as and when we move back into BAU arrangements for contracting, we start where we left off rather than start again. But equally, as part of our planning for recovery with providers, we are taking stock of the investments or the contractual commitments we jointly were planning to enter into to really test them in terms of fitness for purpose and feasibility. So I think we're going to need to do a lot of work on that during this year and as we go into next year.
Thanks, Sarah. That's really helpful. So there are a couple of questions for you, Usman. And I guess just the first thing, well, I wanted just to thank you and the team very much indeed for a phenomenal job during a really difficult time. So thank you for the great work that you've been doing as a finance team. And I know that on top of an already difficult job, you have also been trying to manage all of the PPE, the protective equipment requirements for the STP. And I just wanted to check with you whether you just wanted to say a word or two, because I know it will be on people's minds in terms of the supplies of PPE to our acute trust, but also importantly, I think, to primary care and care homes. Did you want to just say a word or two before we go to some of the specific finance questions?
Yes, happy to. So I think clearly, I think there's been well documented and it's been in the press. I think, however, from South East London perspective, I think early on we've pulled together a sort of South East London wide PPE team who drawn from colleagues from both providers and commissioning, but more importantly also from local authorities. So we've worked really closely with local authorities right from the start of this. We have daily calls with local authority and borough leads. We also have regular contact with the local authority SRO, sort of the lead director who's in charge of PP. And I think for us, managing the acute side has been really important, but we've also been really conscious of primary care and care homes. So I think we've every day been monitoring stock levels at all of our organisations, so all care home providers. We've been working with local authorities to move supplies when required from NHS stock into care homes to make sure that there were no stock out issues. And I hope I'm right in saying this, and someone will correct me if I'm wrong, but I'm confident that I don't believe we had any stock out issues in South East London at any point. I mean, it's been tight at various points and it has been difficult and challenging, but I don't believe with any of our provider organisations, acute hospital provider and then our care home sector, we ever got to a point where we had stock outs. I think we've worked really well as a system, health and care system. And I think there are some really good lessons we've taken out of this that hopefully we'll take forward once we come out of the immediate crisis.
I think that's right. So just to reinforce what Usman has said, he and his team have done a fantastic job, not only around PPE, but everything like supplies of oxygen and some of the drugs that are needed. So thank you.
Thank you.
Very much appreciated. Thank you. So we've got a question. So I think Sheila, first, you wanted to come in. You may be on mute, Sheila.
Yes, I was just going to raise the question of the risks. I know, as when you've gone and said that, shall we say, it's likely to maybe be addressed when you actually have the guidance. But essentially, shall we say, we were looking at 35 million less the contingency in three main areas, which was the contracts, which I know Sarah's slightly addressed, GP at hand, and QIP. I'm assuming all the QIP projects have been paused, and so actually now, shall we say, that sort of risk was hopefully going to be mitigated over a period of 12 months, and I suppose realistically the QIP schemes will probably only have 6 months to achieve any savings. I just wondered if you know, you could maybe give a flavour of how likely you think that, shall we say, the three large risks could crystallise, or whether you believe that there are mitigants that can be found even late in the day.
So I think in terms of the three main areas there, I think you're right, those are the key ones. In terms of the contract discussions, I think as Sarah's highlighted, that was probably a slightly pessimistic position that we had put in here. Sometimes as accountants, we like to make sure we're on the side of caution. And I think that was done at a certain point in time, and it probably wasn't quite that high. And as we move into 2021, given the arrangements that have been in place for the first 4 months with providers in terms of direct national top-up payments to organisations, that risk is potentially more mitigated than it was when we had it there. In terms of GP at hand, I confess we were having ongoing live discussions with London, regional level and the national team. As the COVID sort of pandemic started, we will need to revisit those, and I don't think I could give you an update on that one at this point in time. In terms of QIP risk, I think there's been a general recognition that both within so all NHS organisations, acute providers and commissioning side, the delivery of the original QIP and SIP sort of savings targets is going to be very, very difficult, given all of the things that we will continue to have to do, even once the initial crisis is over and the additional costs will be incurring. So I think we've been having sort of live discussions with regional and national finance colleagues about how we manage that going through the year. So I think that risk potentially will come down, but I suspect we will still, especially going into sort of quarters 3 and 4, be asked to still make some level of savings. But as we get additional information on that over the next couple of weeks, I'm hoping, and we get some more clarity in terms of the new national rules that have been set out, we'll be able to provide an update at the next governing body meeting.
Thank you.
Thank you indeed. Thanks, Usman. Flake, I think you just wanted to also come in, is that right?
Yes, that's right. I just, it's just following that comment and in the notes about the Lewisham and Greenwich Trust contract not being signed before the end of March. I was just asking, are there any, what the implications of that are?
I'll leave, Sarah, do you want to take that one?
Yep, happy to. I mean, in fact, no contracts were signed. We were instructed not to sign any contract. What we've done is codify, so agree our heads of terms with the other providers, not LGT. As I said a few minutes ago, the vast majority of the contract had been agreed with LGT. There were just 1 or 2 outstanding items, but we will have to revisit every single agreement in the context of planning for recovery and where we outturn COVID financially and in service delivery terms. So I don't think the status that we'd reached at the end of March vis-a-vis LGT compared to the others will make any material differences as we plan going forward.
Thank you, and thanks for the question, Flake. I think then a final question from Krishna.
Congratulations to Usman. You started early. The team started planning early before the merger, and you've done a very good job. Just a question, that even if we can't cover it today, probably something to discuss in one of the development meetings. When we are doing the planning and budget setting, South East London CCG is a new organisation, even though we have been working as an alliance. What are all the principles which guide us when we decide on the budget setting, planning and investment, when it comes to the needs of the population and how the money follows the needs to address the gaps? And if something is not working as well as it should, what is the procedure to address this as an organisation so that it's functioning very well?
So I think you're right. It's probably one that we need to think about some more and pick up in one of the development sessions. I think prior to the sort of start of the COVID crisis, we were sort of in the process of trying to finalise draft policies around investment principles, you know, strategies for how we were going to, what the financial frameworks would look like. I think we'd had conversations as a board about sort of health inequalities and how we address those. I think those are all important things that we'll probably come back to again and sort of as we start moving back into business as usual and work out how, I think, addressing health inequalities, addressing the increase in health inequalities as a result of the pandemic is clearly a real really clear focus of the response anyway. So I don't think that anyone is not taking that seriously. I think it's just a case of we'll probably need to go back around that as part of our recovery and link it in through that work.
Great, thank you all very much indeed. So can I just check whether we have any further questions for Usman or for Sarah? Great, thank you, and thanks again for all of the hard work that you and the team have been doing, Usman and Sarah, to get us to the position that we're in at the moment, recognising that obviously it is quite complex and will be quite challenging this year, clearly. So we will want to keep quite a close eye as a governing body on the financial situation as it progresses. But thank you very much indeed. So I'm now going to open up to some further questions that we have had submitted from members of the public, and thank you very much indeed for the interaction that there's been during this meeting. So I'm going to take some of these questions one at a time and come to individuals just to answer them. The first question from Nicola Kingston is really around these the process, I think, because it feels as though we haven't yet fully answered all of the questions we've had submitted prior to the meeting. Christina, I wanted, I guess, to both reiterate the process, but also understand how we ensure that we can more fully answer all of the questions we've had submitted.
Sure, thanks, Jonty. Yeah, so obviously we do our best to try and respond either in advance of or after the meetings. I think a lot of the questions, we've had a lot of questions, which is fantastic, but clearly we need to work through those. And also quite a lot of the questions require responses not only from the CCG, but actually in order to respond fully to get them from our partners. So we will be doing that, and we have, hopefully by providing some of the answers ahead of time, we are responding very rapidly where we can, but we are absolutely working through the broader answers, and we'll come back to people as quickly as we can. Just to reiterate as well, as part of our working in a different way in this COVID times, we've accelerated the publishing of our minutes and the Q&A, so those will be out much quicker than the next meeting. So hopefully with those things in mind, we can, people feel that is a sufficient response to that.
Thank you, Christina. There's a question from Fraser Sim. So Fraser, you have helpfully asked about any deaths of members of staff in GP surgeries. And I guess it's really important to acknowledge the impact that the pandemic has had on staff. So I really appreciate the question. We don't keep a log of the numbers of people who have died as a result of the pandemic in general practice, but there is a great deal of work going on at borough level where the relationships really exist between the practices and obviously a number of colleagues here as part of the CCG. I do know that there have very sadly been a small number of deaths in practices. I'm a GP that also works in Lambeth, so I'm acutely aware of the impact that has had there, but we don't log the exact numbers. Following the meeting, if it would be helpful, I'm very happy to come back to you, having spoken to colleagues in each of the different boroughs to update you on that, if that would be helpful. But thank you very much for the question, because I do think it's really important that we recognise the impact that this has had on staff as well within our health and care services. There's a very, very helpful comment from Maureen Simpson about the way in which we organise the meeting at the moment. I think let us look into how we respond to this, Maureen. Essentially, Maureen is asking whether we can name the CCG participants as they speak on the screen. And I guess there's a question there as to whether the technology would enable us to put people's names up. Otherwise, we could ensure that people introduce themselves before speaking, or I will try to make sure that I introduce people and their particular roles or titles before they started speaking. You have helpfully, Maureen, suggested the other option would be to wear a good old-fashioned name badge. Again, it depends a little bit on the position of the camera. That's not going to work for everyone looking at the pictures in front of me, but let us see what we can do to try to help with that going forward. We are learning and really appreciate comments to help us get better at this. And I also very much appreciate your positive comments about the videos that we were able to share and the work that's happening. And I will certainly pass on that to members of staff. We have a question which has been submitted, which is why are those over 70 years of age suffering from diabetes not shielded, given that statistics now show they are much more vulnerable to COVID-19? And I wanted to go to Kate first to help us to answer this. And in the meantime, I don't know whether public health colleagues, whether Nada or Angela have any thoughts on that, but I'd like to go to Kate in the first instance.
Yes, so thank you, thank you, Jonty. So it's Kate Moriarty Baker. I'm the chief nurse, just so people know who's speaking. So I think there was a number of ways that people were identified as shielding at the beginning of this COVID pandemic, and we were sort of. There were two groups identified, so people at very high risk requiring shielding, and these were people who had specific cancers or people with receiving immunotherapy or transplants, severe respiratory conditions. And then there was also within that, there was another group of which was sort of classified as moderate vulnerable risk, which did include people with a number of long-term conditions, including diabetes. So people with diabetes were identified at the beginning of this process, and also people who were 70 plus. There were a number of ways that people who required shielding or were particularly vulnerable were identified, and this was via hospital, trust, primary care, identifying people on their caseload. Local authorities also identifying people who were at a high risk for social care, other reasons as well as health. And there was also an opportunity that people were able to self-identify themselves. And I think this was guidance that came out to us, and certainly other people, depending on their particular health needs, would be considered into that shielding group on a case-by-case basis. I think we certainly, and look to my public health colleagues to comment as well on this. I mean, we have certainly identified, of course, as the COVID has progressed, where we are able to see, we are able to understand and learn as we go through this, who are more vulnerable to COVID, and I think that that changes thinking as we go through a pandemic, and clearly that that is a process. But I don't know if Angela, if you would want to add anything else.
No, Kate, I think you've described it very well. People with diabetes are known to be vulnerable, and that's very well recognised. I also think that, as Kate says, we're learning as we go along. Well, the world is learning as it goes along, but also there is a very individualistic response to the COVID-19 infections, and sometimes it's not always possible to exactly predict who's going to get worse infection. But clearly there are some groups that are, and the evidence is emerging around that. So I think if a person has diabetes, we would strongly recommend that they classify themselves as very vulnerable and take appropriate measures and protect themselves.
Thanks, Angela. And I guess it's important to recognise that this is obviously a national initiative, but there's been an enormous amount of work on the ground to ensure that those lists do capture as many people as possible who are in those shielded categories. I guess what I'd flag, and we saw a video from Linda Drake in Southwark, and I know this has been happening in all of the boroughs, is that that absolutely hasn't been the beginning and the end of the work that we've been doing with vulnerable patients in our boroughs. We certainly haven't limited that to those who, if you like, are specifically categorised across or in as shielded. We've been working proactively with all of our vulnerable patients because we recognise there are a number of people who do have particular susceptibility, but we also recognise there's an enormous amount of anxiety. So the work going on in practices and with local authorities and community services has very much tried to focus on those people who we know in our boroughs will be concerned about this. Really helpful, and thank you very much for that that answer, Kate and Angela. We've another question that's come in. The questioner asks why it would appear that the CCG has put on hold all individual funding requests even before the lockdown within London, with no communication from the organisation on this. There's a follow-on, I believe, which is that does no recourse to public fund mean that independent funding requests have been put on hold, if I understand this correctly, and when was this implemented? Angela, are you going to speak to this? Yeah.
Happy to answer that. Just to say, my name is Angela Barn. I'm Managing Director in Bromley. So we haven't stopped taking individual funding requests at all, really. So I'm not quite sure where this comes from. What did happen before the lockdown started and well, before COVID, is that over several months we had been bringing together the processes of all six CCGs, as were then, into a single process. It shouldn't have affected the way that, and I'm sure it didn't affect the way that patients requested individual funding requests, or indeed as clinicians requested this sort of consideration. So there has been no change around that. What we haven't done, and I don't think we would necessarily have done this particularly, is to advertise or encourage this. But where patients have come to us, we have put them through the single process that we've got. And if there are instances where members of the public, patients or clinicians feel that an IFR, an individual funding request, was not managed or taken through the system, then please do flag it up with us. The no recourse to public funds is a completely different issue to the IFR process. The no recourse to public funds is people who are not entitled to benefits, housing, any other things of that nature. And often these patients are a little bit stuck sometimes. They may have come here for a holiday or a period of stay and not been able to get back home. And as a result of that, it is sometimes difficult it's impossible for a local authority to take responsibility for them because they're not their residents. And the other group of people that would fall into this category sometimes are those who are homeless, who are street dwellers. And I think but the two processes are completely different. Thanks.
Thank you, Angela, very much. So we have a final question, I think, given the time. I'm just checking. We have a question on inequalities. There are a few parts to this. So the question is, what is the work being undertaken by Lewisham and Birmingham in relation to BAME health inequalities, and to what extent is the Lewisham BAME network involved? There's a second part. I think I'll come to you in a second, Martin, because clearly there's a specific question there about Lewisham. Can the CCG share the Lewisham Public Health Report and the work mentioned being done in Southwark? I've certainly, I think, already committed to us trying to share the work that's going on in individual boroughs, which I hope will be helpful. And then the third part is there are some concerns about the work with Birmingham and the level of engagement with other stakeholders. Can you comment on this? So not absolutely specific there, but Martin, would you like to say something about this work?
Yes, thank you, Jonty. So this is work that Lewisham Council have signed up with Birmingham City Council. It's an 18-month research partnership that they've agreed basically to work together to share insights, to look at work that's going on already in each of our areas, and to, with some academic rigour, work together to see how we can inform each other about how we might break the cycle of inequalities. It's specifically on Black, African and Caribbean communities, and it clearly will, it's about how do we learn from that and influence our local plans. We already have local plans that we've agreed through our health and wellbeing boards. This will inform and further strengthen those plans already in place. The council will clearly lead the moment setting up those arrangements. It was only announced, I think, in very early May, so we have, I don't think, set up the sort of governance structures around this particular research partnership. But I can assure members of the public that it would be reported to our health and wellbeing board. Clearly, we haven't had one in COVID, but when they are resumed, the part of the question about the local BME network, they are already involved in our local work with our Director of Public Health and with mental health commissioners and others, and I expect they will still continue to be involved in this work going forward.
Yeah, great. Thank you, Martin. That is really, really helpful from my point of view. I guess what I wanted to do was just to thank everybody who has sent questions in. We haven't had time to cover all of the questions. I know there've been a huge number. What I'm going to do is, as I said at the beginning, ensure that answers to all of the questions that have been submitted are published. So even if you have asked a question and we haven't been able to get around to it during the meeting, we will ensure that all of those questions are published. And I really genuinely do appreciate the interest there is in the work that's going on at the moment. It's incredibly important to us. I wanted just to turn to the governing body to ask if there is any other business. I'm only aware of one item, Neil, that I think you perhaps just wanted to mention in regard to work that's happening with borough-based boards.
Yeah, I just wanted to highlight, obviously, in the Prime Committee's report, we highlighted that we'd stood down our borough-based boards during May, but just to say that we are planning to have public borough-based boards, I believe, in every borough. I believe Lambeth's in June and all the other boroughs will be in July, and obviously that be an opportunity. They'll be held in public, probably using virtual technology, but an opportunity to explore some of the local work, which I know is really important for our wider public. So I did want to highlight that.
Thank you. That's really helpful, Neil. Can I just check? So again, probably not helpful to ask if there are any other items of business, but well, does anyone have any further items of business they want to raise? I'm not seeing any indication. Excellent. Well, in that case, I think that brings to an end the inaugural meeting of the South East London CCG. Again, I guess I just wanted to finish by expressing my thanks to the governing body and officers for the incredible work they've been doing, as well as staff. It's been an absolutely really inspiring time to be working in many ways. Whilst it's been very challenging, I think the levels of cooperation and partnership that certainly I've seen across the system have been fantastic. It's been a very, very hard few weeks for our partner organisations as well. And I think in many ways the level and intensity of work isn't settling, because we now have to move so rapidly into planning to ensure that we can pick up an awful lot of the work that people in their questions have already identified over the coming months across South East London. So I recognise that there is not time to rest, but I equally wanted to flag the importance of the health and well-being of our staff as part of this process. I know it's a high priority for everybody, and I do hope that everybody manages to get some rest over the coming weekend. So on that note, I'm just going to say thank you very much. Thank you to those of you who have attended and to the governing body, and we will see you at the next meeting and publish the minutes of this meeting and the responses to the question as promised. Thank you very much indeed.